Kathaleen King-Dailey's athletic calendar is booked between running events when it's warm.
Always tried to put a half marathon on my schedule twice a year, one in the spring, one in the fall, and that was my motivation to stay fit and get to the gym.
And when it's cold, Kathleen and her husband head to the slopes.
I grew up skiing, and as an adult, I started going out west skiing at least once a year, and every year tried to hit a different place out west to ski.
I'll be very honest, I never skied till I met her, and so she was my driving force behind that, and I'll tell you, she taught me a lot.
About 5 years ago, Kathleen began feeling the effects from these activities.
I started to notice that with the higher impact exercises, I was having some problems with headaches.
But last June, Kathleen experienced more than a headache after a short run.
I had severe pain down the right side of my neck, down between my shoulder blades, and I could hardly lift myself out of bed. I had such weakness in my neck, and I thought, that can't be good.
It actually made all of us very nervous. This is probably the toughest woman that I know, and I will tell you, the sheer pain, if you look at a scale of 1 to 10, it was probably a 12.
Kathleen reached out to Penn State Health for guidance.
So the MRI showed both at the C6-7 level and the C5-6 level, and the levels are named after the discs. The bones are the numbers, and then the discs are between the numbers. So the C5-6 disc, C6-7 disc, at both those levels, the disc had herniated, or it was bulging backwards into where the spinal nerve root was, and it was pinching the nerve roots at those levels.
I was terrified because I am an outdoors person, and most of what I love to do in my free time involves some sort of outdoor activities, whether it's kayaking, skiing, hiking, biking. And so I was pretty terrified that life as I knew it may have been over.
Surgery was recommended.
I was excited that there was a way and an answer to get her back to where she wanted to be, instead of this is going to be your life now and change it forever.
I wanted to do it as soon as possible. At that point, at that point I was having so much pain, I knew there wasn't another option.
The surgery date was set, August 19th, 2022.
So when you take the disc out, you have to do something to rebuild the spine, and kind of the traditional 20th century thing was a fusion. But luckily now that things have evolved, we actually now have a little disc replacement. So when you take the disc out, you can actually put something in there that allows the spine to keep moving at that level and not fusing it.
I woke up after surgery, and the pain that I was experiencing on the right side was like already completely gone.
And her eyes teared up. I think we all teared up at that moment. Finally, she had some relief after all this time.
Just 2 months after surgery, Kathleen and Brian were on a missions trip in Africa.
She's doing so much better. Her whole reality has changed since before the surgery.
I feel great. I am just so thankful that I have my life back and I'm able to do everything that I was able to do before, but without all that neck pain and headache pain that I suffered in the past.
And this past March, Kathleen and Brian participated in a 10K race in the Lock Haven area. As she said, the surgery gave her her life back.